University of Texas at Arlington, and today I'm going to present to you early identification and treatment of sepsis management. So, our stated objectives for today will be to differentiate between systemic inflammatory response syndrome, SIRS, sepsis, severe sepsis, and septic shock. By the end of this presentation, I will expect you to be able to discuss the elements of sepsis resuscitation bundle, describe the role of the nurse in identification and assessment of the patient in severe sepsis and septic shock, and I will expect for you to be able to identify the evidence-based interventions for managing patients with severe sepsis. So let's talk about some statistics here. According to the CDC, sepsis is the 10th leading cause of death in hospitalized patients. It is the second leading cause of death in non-coronary ICU patients. And from 2000 to 2008, sepsis cases nearly doubled worldwide. And approximately 28 to 50% of people with sepsis succumb to death. So what exactly is sepsis? Well, simply put, sepsis is SIRS due to infection. So it is a systemic inflammatory response to illness. So here we have the sepsis pathways here. And at the top, you can see the infection, which is an invader, and it has to have a way of entering into the body. So sometimes it's just through an open orifice, a cut, even a scratch, or either it can be caused by post-operatively. You can have it caused by a wound, and also too for patients who may come in with be diagnosed with UTIs. This is also an entrance for infection as well. And then you have the microbial toxins. They come in and they try to set up what you call shop inside of your body. And then by this time you have a host defense system activation. This is where your body starts to respond to the infection. And then you have the inflammatory response syndrome. So you may see a patient may come in complaining of a fever, chills, body ache, malaise, fatigue, which are some of the general signs that you will see in your patients. Now here, we want to hopefully stop the infection here at the inflammatory response stage. And if we can get adequate control of the infection, and this is usually, if you can control it, you can clear it. And control usually happens when you start early intervention of antibiotic therapy. But just for instance, if you don't get adequate control of the infection, a patient comes in much later, and the infection is allowed to ensue, then you have this, the uncontrolled infection, which is ongoing and releases more toxins. Here your body starts to become overwhelmed, and then you have tissue injury. Your tissue injury could be a patient that has AKI, acute kidney injury, or acute renal failure. And it's been in my experience as a nurse that patients who usually have early signs of sepsis, which lead into severe sepsis, their kidneys will most likely be the first thing to tell it. So you may have a patient that has oliguria, very little urinary output. In patients with Foley's, this can be easily recognized, but however, in patients that do not have a Foley catheter, you would have to, question a patient, how often are you getting out of the bed to use the restroom, what does your urine look like, and so forth. And another indication is to also look at your patient's lab work. You want to make sure, check your patient, especially creatinine level, because it will always give it off. If there's a creatinine level greater than 2, then you can definitely tell that there is something going on with that patient. And then if it continues on, then you have the shock, and you have multi-organ system failure. Now this is when you see, this is what we don't want. But here you will see the patient will have respiratory failure. You may even see, cardiogenic shock and those type of things. And then death, which is what we want to definitely prevent. So what causes sepsis? So you have over here, these are obviously your bacteria infections right here, which is caused by bacteria, fungi, parasites, viruses. Over here you have your SIRS, your systemic inflammatory response syndrome. Well, your SIRS can be caused by a number of things, particularly trauma, burns, and pancreatitis. Your trauma can be caused by a motor vehicle collision, and your patient comes in with a fracture or ruptured spleen or any of those things. Burns, this definitely allows for invasion of bacteria and different organisms that makes the patient more susceptible, and pancreatitis here. So, like I said, right here we have the SIRS, We have the bacteria. Once the SIRS and the bacteria merge, then you develop what we call here sepsis, very simply put. Now, we're talking about parasites. I thought this was pretty interesting. It's Chagas disease. Chagas disease is was recently, up until recently, very rare here in the United States, but it affects 6 to 7 million persons worldwide, but it's more common in Latin America. Excuse me. But I thought it was very important that we talk a little bit about Chagas disease, because we do live in a very diverse community. We have a large number of people coming from all over the United States and migrating here to Houston, Texas. So you might even see, Chagas disease. So this gives a little overview. I thought it was interesting. So you can just kind of take a look at that. So what are the sepsis risk factors? Well, number one, a weakened immune system. And of course, children, infants, elderly are more susceptible to sepsis than someone otherwise an adult, healthy adult. Patients who have chronic illnesses, this is very important that you know what are your patient's comorbidities. Do your patient have diabetes, AIDS, cancers, kidney or liver disease? These patients right here, these are clinical indicators. So when your patient comes in, okay, what are we looking at? What is this patient in for? What is this patient's past medical history? This is something that you can kind of gauge to identify, how at risk your patient is for developing conditions such as sepsis. So recognizing sepsis. Like stated before, your patient may have fever, chills, malaise, or fatigue. You may have rapid breathing, elevated heart rate, rash, confusion, and disorientation. And usually when you get to here, the confusion and disorientation, this may present a sign and symptom of severe sepsis. And this is more prevalent in your elderly patients, but sometimes with patients who have dementia, this may be hard to identify. So like I said, you have to really assess your patient and know. This may mean that the patient has some type of encephalopathy, or what we call septic encephalopathy. So this is the hierarchy of sepsis. Here we have SIRS, sepsis, severe sepsis, and septic shock.